So patients that are getting ready for surgery, we help them understand that we're very excited for them. We help them understand that we have all of the resources necessary for them to be very successful. Again, I want to reiterate that surgery is not a cure. There's not one single thing that we can do that will allow patients to be maximally successful. But when surgery is used in conjunction with all the other tools that are available to you, then patients can be really successful. We want you to understand that we provide all those tools. So whether you're 6 months out or 6 years out, we encourage patients to continue to stay engaged with us. As I said, having a nutritional plan is incredibly important. Again, we don't teach a diet, we teach a nutritional philosophy. We want you to understand what your body is looking for in terms of nutrition and help you build a nutritional plan that you can do for the rest of your life. Exercise is also something that is incredibly important. Developing a fitness plan is one of the keys to your success. We hear patients tell us all the time that they're not comfortable going to a gym. They don't know what to do. And because of those reasons, we've developed an integrated fitness program. We have an NASM certified personal trainer that works with our patients to teach you all the basics about exercise and fitness and will help get you started on a plan. Many patients tell us they can't exercise, that they can't work out because of their knee problems or their back problems and so on. The encouraging thing is those patients can. They just need to be taught the things that they can do to help develop the supporting musculature around those injuries to offload those joints and help improve their functionality. And so we can design specific fitness programs for you where you are, things that you can do on your own without fancy gym equipment. And we encourage you to help develop that program.
It's normal to be anxious a little bit before surgery. And I think if we didn't have some of that, we wouldn't be normal. And so what I want to do is just kind of try to lower that. I want to go through the risk. I want to go over just recovery, what's going to happen the weeks after surgery. So first of all, I want to start out kind of what we're doing. That day, we're going to do this surgery laparoscopically. Surgery itself takes about 45 minutes. And what we're doing, let me just kind of take you through it. Typically we do this with 5 little small incisions, typically 2 on either side of the belly button, 1 below the breastbone. Most of them are little small ones, 5mm incisions. There is going to be 1 bigger one right next to the belly button here. That's where I'm going to remove the part of the stomach. Half of patients can go home the same day, and usually we determine that at this visit. And it depends on just motivation, medical issues, but honestly, I see about half of patients go home and they do very well. The other half of patients stay in the hospital overnight, and usually by mid-morning the next morning, we let you go home. Now, as far as being off work, it varies, but on average, about 1 week off work. We do put a limitation of no heavy lifting over 15 pounds for 3 weeks. And the reason being is this bigger incision, we have to put a deep stitch in there to bring the abdominal wall together, and we don't want you getting a hernia. And so no heavy lifting for over 15 pounds for 3 weeks. So it kind of depends on what type of work you do and when you can go back to work. As far as driving, once you're off of the pain medicine, I tell patients you can be driving. And that varies. It can be as soon as 1 to 2 days after surgery. I discuss this with patients. Their first month can be challenging, and for a few reasons. Number 1, your energy level's down. Surgery just takes the energy out of you. Number 2, the diet after surgery. It's real important to follow that diet. What I usually see is about the month mark, your energy level's coming back, you're back to eating regular food, you're losing weight, and you're feeling great. Now, there may be a week or 2 right after surgery where patients are asking, why did I do this? And I tell patients that can be normal. But getting through that first month is what's critical. And what I usually see is about the month mark. Your energy's coming back, you're eating regular food, you're feeling good. And patients always tell me, I'm really glad I did this. So I tell them, sometimes we just have to get through that first week or 2.
The first 2 weeks is a very low threshold to call us. Questions, concerns, issues, problems, confusion, anger, boredom, it does not matter. Call us. 2 a.m., 2 p.m., Saturday, Sunday, church time, Cowboys game, doesn't matter. 806 806-677-7952. It's our clinic number. It's 24/7. Not a time to tough it out. Not a time to wait till Monday. Not a time to call Cousin Jenny, the ER nurse in Hereford. Call us, okay? Next thing is potential risk involved with the surgery. In our clinic, we strive to make things as safe as possible. We have 2 surgeons in the operating room. We have a lot of protocols in place to help you, to make sure that we're doing the safest thing for you. Major complication rate in our clinic is less than 0.1%. The things that we watch out for in the first 24 to 48 hours are leaks and bleeds. A leak means that something that we've stapled or sewn together is not holding, and now you have fluid spilling into your belly. That is not good. That's very sick. That's flu times 10. You'll know if a leak is going on. That's one of the biggest questions is how will I know? And the short answer is you will know. You will not feel very well. That's an immediate phone call if you're having any of that stuff going on. Like I said, that should be less than a 0.1% probability. The treatment of that varies. Sometimes it's just some simple drains. Very rarely does it require us to go back to the operating room. We'll do everything to help you out in that scenario. But to reiterate, that should be a very rare occurrence. Bleed rate should be slightly higher than a leak rate. Luckily, with the sleeve gastrectomy and the duodenal switch, we're not dealing with any significantly large vessels. So it's unlikely that we have to re-intervene on bleeding patients, but it can happen. Usually with bleeding that requires us to go to the operating room, we have to go back and find what's bleeding and address it with clips or coagulation of some sort. But that should be extremely rare. All the other complications or the other potential complications that come with surgery are the risk that we see with any surgery. Heart attacks, clots, pulmonary embolisms, strokes, things of that nature. Those are all astronomically rare. We look forward to walking this journey with you. We want this to be the first step into your new lifestyle. We want to walk that journey with you in our clinic. Do realize that this surgery is just a start. You have to continually seek education to be healthy and fit. I kind of tell my patients that being healthy is an active pursuit. It doesn't come passively. Just like most things in life, we can't expect health and wellness just to show up on our doorstep. Having a surgery is just the first part of this journey. You have to use this surgery as a tool that's going to continually help you for the rest of your life. But the rate limiting issue here is that it's just a tool.